Hello, my name is Dr. Martin Donahue. Welcome to Prescription for Justice. Tonight we will spend the entire half hour discussing a very important issue in the era of Trump: access to comprehensive reproductive health care services for women not just in the United States, but worldwide. Today, women face social, legal, political, and educational marginalization. Worldwide, women do 2/3 of the world's paid and unpaid work, hold only 23% of legislative seats, receive only 10% of global income, and own only 1% of global property. Women make up 45% of the employed global workforce, yet account for 70% of the world's poor. We know that the more patriarchal a society is, the higher the mortality rate for women than for men. In the United States, a woman working full-time still only makes about 75 cents on the dollar. Not much of a change from the 1970s. More than half of working mothers get no paid sick leave, although some localities have passed laws to change this, including, I'm proud to say, Portland. Women comprise 51% of college graduates and make up 46% of the U.S. workforce, but hold only 5% of CEO positions and less than 20% of corporate director positions in Fortune 500 companies. Looking globally, every minute on this planet, 380 women will become pregnant. 190 will face an unplanned or unwanted pregnancy. 110 women will experience pregnancy-related complications. 40 will have unsafe abortions. And 1 woman will die while giving birth. During the half hour that this program is on, 3 women will die from an unsafe abortion. So, thinking about the status of women in the U.S. and worldwide, one of the key things that we can do to improve that status is to give them control over their bodies, to give them back their reproductive rights. Let's talk a little bit about pregnancy, access to contraception and emergency contraception. I'll give you some facts about abortion as a procedure, and we'll talk about some of the obstacles that women face in this country and worldwide in getting contraception, emergency contraception, pregnancy termination services, and even access to a clean hospital in which to give birth. Half of all pregnancies in the United States are unintended, including 1/3 of those that occur within marriage. This means that there are 3 million unintended pregnancies in the United States per year. By age 45, the average female will have had 1.4 unintended pregnancies. And 34%, make that 35% of women, or just over 1/3, will have had an induced abortion. We don't see or hear about these women often, but they're there. In 2014, there were 926,000 abortions in the United States. This number is down 50% as adjusted for the population compared to 1980. In the pre-Roe v. Wade era, there were between 700,000 and 830,000 women each year who underwent an illegal abortion in the United States. Many of these were unsafe, and often death resulted. Death certificates often attributed the cause of death to something else, like sepsis or infection or bleeding. Unfortunately, many young people today don't know about or are unaware of the implications of the Supreme Court case of Roe v. Wade. Looking at the worldwide situation, there are 56 million abortions per year. Almost half of these are unsafe, and almost all of these occur in the developing world. Each year, 220,000 children are orphaned by poorly performed abortions. Now, how can we get women to take back control over their bodies? Part of this involves legislative measures, but part of this also involves education. And unfortunately, sex education in this country is woefully lacking or incomplete or even downright wrong compared to the type of sex education that kids receive in places like Canada, Australia, and the United Kingdom and elsewhere in the European Union. Misconceptions about sex and contraception are common among adolescents and even among physicians. Discussions with parents and physicians are limited and often occur too late. By age 17, half of teenagers have begun having sex. Unfortunately, the type of sex education that kids get in school, as I said, is often misleading. There is a form of sex education called abstinence-only education. A half of states mandate this, and only 1/4 of states require comprehensive sex education. Abstinence-only education is supported by our federal government. We spend $90 million of our tax money per year supporting this, as opposed to $180 million per year on comprehensive sex ed. Abstinence-only education, and I'll put the education in air quotes, prohibits any discussion of contraceptives beyond failure rates. It tends to present worst-case scenarios of abortions and sexually transmitted diseases. It tries to instill guilt and fear and shame into young people. And it stereotypes boys and girls and places responsibility for refusing sexual advances onto women. It tends to blur the line between science and religion. There are numerous studies that have shown that abstinence-only education does not decrease sexual activity, STD rates, or teen pregnancy. It does not lead to an increased use of condoms or contraceptives. I want to give you an example or two of some passages that I found in federal government-supported abstinence-only education materials. One uses bizarre scare tactics. Quote, "Today, being an adult means being able to participate in all types of perverse activities that only depraved minds can imagine." Others contain errors, such as the quote, "Studies show that 5 to 10% of women will never be pregnant after having a legal abortion." Absolutely untrue. Abortion has no effect on subsequent fertility. Many of these materials contain sexist stereotypes, such as, quote, "Deep inside every man is a knight in shining armor, ready to rescue a maiden and slay a dragon." Or, "Females have the uncanny ability to remember the most insignificant details about past experiences." Whoa, where is that coming from? Here's another one. "Girls will feel, quote, dirty and cheap when they lose their boyfriends after having sex." Or, "Men tend to be more tuned into what is happening today and what needs to be done for a secure future." On the other hand, comprehensive sex education programs, which talk about abstinence as well as contraception, rates of pregnancy, how menstrual cycles work, how STDs are transmitted and treated, have been shown in numerous studies to delay age of onset of first intercourse, to reduce the frequency of intercourse among young people, to reduce the number of sex partners and increase condom and contraceptive use, and, importantly, to reduce the number of unwanted pregnancies. These curricula are supported by a large majority of Americans. Moving beyond education, let's say someone wants to get on contraception. Is it available? Well, use of some form of contraception is increasing. Approximately 80% of people use contraception in sexual relationships today. We've also disturbingly found that male sperm counts are decreasing. In fact, they're down 50% over the last 4 decades for a number of reasons, mostly related to environmental pollution and degradation. This may have both short and long-term consequences for our species. Infertility rates are climbing. In fact, 1 out of 6 U.S. couples who's trying to conceive fail to do so over the course of 1 year of unprotected sex. Limited access to health care in an era when 28 to 29 million Americans still go without insurance is a main problem for women who are trying to access contraception. Some kids can get contraceptives at school-based health centers, but less than half of these dispense contraceptives, and many require parental consent. Contraception is expensive. A very effective form of contraception, or IUD post-delivery, can cost thousands of dollars to put in, and contraceptive pills can run up to $50 per month. Often those trying to get contraceptives can face provider or pharmacist refusal, and these are supported by so-called conscience clauses, which allows physicians and/or pharmacists to refuse to write prescriptions for or dispense contraceptives. In just 3 states, including Oregon, contraceptive pills are available over the counter. But if you look worldwide, there are 106 countries where contraceptives are available over the counter. And these, in fact, lead to no increase in sexual risk-taking behavior, and lead to decreased pregnancy. There are many economic benefits associated with contraception. More contraception use is associated with longer education, and it's estimated that 1/3 of the wage gains made by U.S. women since 1960 are due to having access to the pill. For every dollar spent by the federal government on contraception, just over $7 is saved in terms of health care costs, care for infants who are born prematurely, and other health care costs, and loss to the economy. Once a person has had intercourse, whether or not they are on contraception, and maybe they've used it improperly or a condom is broken, they can obtain access to what's called emergency contraception, which can be used for one type up to 5 days post-intercourse. Public awareness of EC, or emergency contraception, is unfortunately low. This is sometimes available over the counter, but some pharmacies won't stock it or dispense it, again, due to these so-called conscience clauses. Costs can be anywhere from $25 to $50, and yet there's a $1.43 cost savings for every dollar that's spent on emergency contraception. So again, fully funding this would save the government money. Availability of emergency contraception has also been shown to reduce the rate of abortion. Another barrier, once say you've been pregnant, to getting an abortion or pregnancy termination on demand is the cost. There are different types of abortion. There is a medical abortion and a surgical abortion. Most abortions take place within the first 12 weeks. There are two types of medical abortion. One involves mifepristone and misoprostol, and the other methotrexate. These account for about 1/4 of all U.S. abortions, and the average cost of a medical abortion is about $450. Surgical abortions can cost about $483 in the first trimester, and anywhere from $750 to $1,500 for the second trimester. As many as 3/4 of patients pay out of pocket, and even most insured patients are reluctant to file claims due to confidentiality concerns. Often abortion, even when one has insurance, is not covered. For instance, looking at the different types of health care coverage in the United States, Medicaid, Medicare, TRICARE, the Federal Employees Health Benefits Program, all cover abortion only to preserve the woman's life or in cases of rape or incest. 17 states allocate Medicaid funding to cover most abortions. Let's say someone is able to get the money together to have an abortion. One then has to find a facility and a provider who is willing and able to do this. There are only 1,800 abortion facilities in the United States today, down from 2,900 in 1982. Only 14% of OBGYNs provide abortion, and over half of abortion providers are over age 50, meaning that this population of providers is aging out. Today, 89% of U.S. counties, accounting for 38% of the female population, have no abortion provider. 30% of metropolitan areas have no provider. Let's say a woman has found a clinic and wishes to terminate her pregnancy. She then has to face harassment, often getting to the clinic. Providers also face an incredible amount of harassment. Acts of violence and/or disruption at clinics in the U.S. and Canada since 1977 include 12 murders, 17 attempted murders, 41 bombings, 643 bomb threats, 175 arsons, 184 assaults, 100 acid attacks, and 661 anthrax threats. 487 of these since 9/11/2001. Almost 22,000 clinics were blockaded last year. Women also face, just in the public eye, much inflammatory and even misogynistic oratory. For instance, when President George W. Bush was speaking on the 20th anniversary of Roe v. Wade, declaring National Sanctity of Life Day, he likened abortion to terrorism and said, quote, "On September 11th, we clearly saw that evil exists in this world and that it does not value life. Now we are engaged in a fight against evil and tyranny to protect life." Let's listen to some other of our elected legislators talking about abortion. Here's Virginia State Legislator Bob Marshall. Quote, "When you abort the firstborn, nature takes its vengeance on subsequent children," end quote. Missouri Congressman Todd Akin, "If it's a legitimate rape, the female body has ways to try to shut the whole thing down," end quote, meaning prevent pregnancy. Former presidential candidate Rick Santorum, quote, "Back in my day, they'd use Bayer aspirin for contraceptive. The gals put it between their knees, and it wasn't that costly." Here's our hypocrite of the day, former Representative Tim Murphy, who was a Republican from Pennsylvania. He supported a bill making it a crime to harm a fetus during another crime. It's alleged just recently that he urged his mistress to have an abortion. How about current Representative Scott Disjarle from Tennessee? He's an anti-choice legislator who was fined by the Tennessee Medical Board for sexual relationships with 2 patients. He urged his now ex-wife to have 2 abortions, and he encouraged his mistress to have an abortion. There are also, unfortunately, religious bodies that promulgate misinformation and scare tactics to keep people away from contraception, and even from condoms, which are known to protect against HIV and other sexually transmitted diseases. Here's Cardinal Alfonso Lopez Trujillo from the Vatican. He was the Vatican spokesperson on family affairs, and he said, "Relying on condoms is like betting on your own death. Condoms are a highly efficient means of preventing the spread of HIV. We know that. Cardinal Trujillo does not." There are many legal barriers to abortion. One is the point of viability, which was adjudicated under Roe v. Wade, which is now at 24 weeks. Between 1973 and 2015, however, states enacted over 1,000 abortion restrictions, more in the last 5 years than in any other 5-year period. Some of these include mandated waiting periods, spousal notification laws, parental consent and notification laws for teen abortions. And you can imagine that these can be quite dangerous, particularly if a child has been raped by a parent or a step-parent. There are also what are called targeted regulation of abortion provider laws, or TRAP laws, that do things like set the temperature in the clinic, the width of door jambs, require all sorts of excess forms to be filled out, the number of bathrooms per visitor that have to be present, things that other clinics don't face to that degree. And they're basically designed to shut down abortion clinics. Biased counseling laws exist in many states, and these are often deceptively labeled mandated informed consent or women's right to know laws. Under these, women are read a lengthy list of possible but very rare complications from abortion, but not required to hear the benefits of abortion. Many require providers to state, falsely, that abortion can cause breast cancer or so-called post-abortion syndrome or depression. Neither of these statements are true. If someone is looking for an abortion clinic, they may look through the phone book and come across, under reproductive care, pregnancy, counseling, etc., what are known as crisis pregnancy centers. There are 4,500 of these nationwide, and some in fact receive state funding. These outnumber true abortion clinics. At these, one will be read very few true facts about abortion, but instead be given the same sort of information, and they're basically designed to talk women out of having an abortion and instead to go ahead with a pregnancy. Let's talk about some of the facts about abortion, though. Abortion is one of the safest and most common medical procedures available. The risk of death from legal abortion is less than that from a shot of penicillin. It is 40 times safer to have an abortion than to undergo a colonoscopy. And it's 10 to 30 times more dangerous to carry a fetus to term than to undergo a legal abortion. On the other hand, unintended pregnancy is associated with reduced prenatal care, lower breastfeeding rates, and poor maternal and neonatal outcomes. In the Turnaway study, a large study that looked at women who were denied abortions, it was found that those who went on and delivered a baby, as opposed to those who, say, left the state or were somehow or other able to access an abortion elsewhere, that those women denied abortion experienced more resentment and distress, had less employment 1 year later, suffered more poverty and were on more government assistance, suffered from more anxiety and more depression, and had double the risk of domestic violence. And this was not due to getting into new abusive relationships, but because, for the other women, an abortion allowed them to get out of an abusive relationship more easily. Children in the Turnaway study who were born also face social and occupational deficiencies. So, there are other state laws that limit access to abortion. Some of these require pre-termination ultrasound, which is not only unnecessary, but really constitutes rape when a transvaginal ultrasound is done, because transabdominal ultrasounds do not capture images prior to 10 weeks. So basically, requiring a woman to submit to a procedure where something is put into her vagina unnecessarily constitutes rape. Patients are often required to hear about the cost of abortion, and again, lots of falsehoods. There are other laws such as informed consent laws, fetal personhood laws, human heartbeat laws, unborn victim of violence laws, fetal homicide laws, partial birth abortion bans, partial birth abortion being a term that really does not exist in the medical lexicon, the Teen Endangerment Act, the Unborn Child Pain Awareness Act, the fetal pain counseling requirements that some states have. Again, all of this based entirely upon misinformation designed to prevent women from exercising their right to comprehensive reproductive health care. These are some of the folks that have been appointed to government or scientific organizations based on ideology, not knowledge or experience. For instance, under George Bush, the lesser, an OB/GYN, Dr. Hager, was appointed, and he was the author of his Jesus Cared for Women. He advocated scripture reading and prayer for PMS and reportedly refused to provide contraceptives to unmarried women. He was accused by his wife of serial anal rape. George W. Bush also appointed as an FDA representative Dr. Janet Woodcock, who said that selling Plan B over the counter would transform it into an urban legend that would tempt adolescents to create sex-based cults. Unfortunately, our current president is a narcissistic, sociopathic, misogynistic, admitted sex offender and sexual predator. Our vice president passed a law banning abortion on grounds of fetal anomaly, including Down syndrome, and requiring fetal ultrasounds before termination when he was governor of Indiana. This was cut down by the courts. Trump has now signed a resolution allowing states to restrict how federal funds for contraception and reproductive health care are spent. The Republican House is calling for defunding Planned Parenthood, and a new administrative rule will greatly expand the number of employers and insurers that could qualify for exemptions from the mandate by claiming a moral or religious exemptions, including for-profit, publicly traded corporations. In other words, if your company is offering you health insurance and they object to you having access to contraception, they will be allowed to do this. Trump reinstated the global gag rule, instead calling it, somewhat Orwellianly, the Protecting Life and Global Health Assistance rule. This requires every global health organization that accepts U.S. funding to pledge that it will not carry out abortions anywhere in the world, even with its own money, to discuss abortion or lobby governments to liberalize abortion policy. Almost $9 billion in funding hangs in the balance, including money for the State Department, the U.S. Agency for International Development, and the Defense Department, covering maternal and child health care, HIV, and other issues. An International Planned Parenthood Federation will lose $100 million since it's already stated that it will not abide by the rule. We have cut off funding for the UN Population Fund. We have proposed to cut all overseas family planning aid, which amounted to $600 million in 2016. And the Office of Adolescent Health's Teen Pregnancy Prevention Program was just recently halted. Trump's 2018 budget asked for a massive increase from $90 million per year to $277 million per year for abstinence-only education. And we can expect nominations of many anti-choice judges. Roe v. Wade may truly be at risk. Unfortunately, the Democratic Party has also taken a step backwards, announcing that it will not require candidates to be pro-choice in the future, that it will still support candidates who are anti-choice. So what do we need to do? Again, this is very important. This is half the population being denied access to a basic medical and human right, that is, control over their reproductive destiny. It's not up to us to say what they should or shouldn't do. It's not up to us to be moralistic about this. The decision to use contraception, emergency contraception, or have a pregnancy terminated is a very personal and individual decision that should take place just between a woman and her doctor. Where are those in the right wing who are for limited government, when it comes to abortion laws who continually try to put Uncle Sam into our women's uteruses. Restrictions on access to abortion and other reproductive health care services unfortunately remain widespread, as we have seen, and vigilance and legislative efforts at the federal and state level and in the courts will be necessary to preserve and protect women's right to choose. Provision of full reproductive health care to women worldwide is just, would improve the lives of women and children, and is cost-saving. We need to do this not just for women in our country, but for women all over the world. Providing high-quality contraception to all sexually active adolescent women who want to avoid pregnancy would cost just $21 per year. And planet-wide would lead to 6 million fewer unintended pregnancies each year, over 2 million fewer unplanned births, over 3 million fewer abortions, 700,000 fewer miscarriages, and over 5,000 fewer maternal deaths. The amount of money needed each year in addition to current expenditures to provide reproductive health care for all women in developing countries is just $12 billion, the same amount of money we spend annually on perfume in Europe and the US. We need comprehensive sex education, fully funded access to all forms of contraception and to pregnancy termination upon request up to viability, improved education and training of students, trainees, and providers, and more public health educators, public education campaigns, and we need to bring contraception and abortion out of the closet. This means more activism, more protests, even ad campaigns by women who are willing to stand up and say, "My name is so-and-so. I had an abortion. My name is Jane. I'm a minister. I'm a scientist. I'm a mother, and I had an abortion." Get the government out of our women's uteruses. Let's put the science back in contraception and empower women so that they can achieve their rightful place in the world. My name is Martin Donohue, and this has been Prescription for Justice. Thank you for joining us.